you get to go. Everyone gets to go into the giant like centrifuge where they spin you again. They usually spin you until you like pass out. Um, and you know that you get to experience like low oxygen environments and how it feels to have like hypoxia to the point where you're about to pass out or you do pass out. And so you go to these, I think they're like hypobaric chambers that they like that the military has. They have all these like all this like all these fancy like gadgets and things. It's almost like out of the movie. Like they have this like big facility in Toronto. It's kind of like hidden, but yeah, it's where they developed like the first G suit, which is what the pilots wear so that they don't like it kind of like squeezes their like legs and their torso to keep the blood in their head when they're like doing the high G maneuvers. So the first G suit was like developed in Toronto in secret, and like it's still there, and that's the place that kind of that has all this cool stuff, and still to this day does all this like cool research on like aircrew and pilots and whatnot. So you get to see it.
That is really neat. And then I understand there's the dive medicine aspect too. This is another one of the unique parts of working on base and working with Callian here is this unlocks another one of these like unknown to the rest of us facets of medicine. What is dive medicine all about?
So it's sort of like the flight surgeon part, but the flight surgeons they deal with like aircrew, and the dive medicine certified physicians they deal with like divers and people that go like underwater. And it's the same kind of process as being a flight surgeon. I I don't know the details of like what you get to do, but the people that have done it all tell me that it's a lot of fun and that I should go for it if there's an opportunity.
And then how does that work in terms of the opportunities? Like at some point, do you just have seniority and you qualify to start doing these cool things, or are some of those doors open at all
Some
points
of
in
those
time? You
doors
just
open right
choose to
away.
do
It
it.
all depends on like the operational needs of the base where you get your job. So like there was one Callian physician. She was like a family doc for something like I think like over 15 years, and she just started working with Callian in November, and like she never worked in the military environment before, and she was on the basic aviation course with us in like January. So yeah, there was a need, so
Quick turnaround.
and she was there, so they filled it.
And then what does the career trajectory look like? Like, is there sort of a hierarchy or is there a ladder to be climbing? I know, like, if I'm being a physician in the community, you sort of have your position and you see patients, and there's not like a whole lot of room for advancement unless you sort of switch completely what you're doing. How does that work if you're working on base?
So it's sort of similar. I mean, there's a lot more advancement if you're a military physician, but I would kind of say that like their advancement, the more they advance in their careers, the less like actual clinical encounters they get to do, and it's more about doing more admin and admin. So if you kind of like medicine, like seeing patients and doing patient care, you would probably hate that. This is one thing that
Yeah.
as a Callian physician you get to keep doing. Um, and these courses, by the way, so like either the basic aviation medicine or the flight surgeon medicine course or basic aviation medicine, those are sort of like advancements in and themselves. So when you get certified, you can start seeing a new patient population, and it's more sort of on the occupational side of things, but you get to do more occupationally in terms of medicine, and it also comes with like a pay raise. So you get remuneration for doing it, and again you get other perks. The other perk would be like I was saying, like carrying the on duty phone, so you can kind of do work after hours and weekends if you choose so. So it's all these things are optional. No one's going to force it on you.
How does it work? Because you're not like enlisted, you're not going to get deployed anywhere. When it comes to you're currently in Ontario, did you get to choose that specific base, or do you get to pick from openings, or do you get kind of voluntold where to
You
go?
get to pick from openings. So like if you contact Callian, you can tell them like I kind of want to work here, and they'll tell you if there's an opening. Um, there sometimes they'll tell you that there is no opening when clearly like that base has no people, and usually the opening will come like later on. But if you kind of have your heart set on a specific like location where there's a base, you can usually, even if there's no opening, all you need to do is just wait for a couple of months, because the military physicians, they get moved around so much that usually there's going to be an opening fairly soon, even if there's not one right now.
I'm Dr. Jordan Vollrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.